That's how I used to call my kids. Good morning. Glad to have you back this morning and see that you all made it off of the Riverwalk and back up to the hotel. Hope you had a good night last night. And we're pleased to see all of you here this morning. It's my great privilege to introduce this morning's keynote speaker, Karen Blase. Karen's been at this business for a long time in a lot of different roles and capacities. She's been a service provider, an educator, a program evaluator, an author in the human service field for over 30 years. So she brings to this Blueprints Conference a great wealth of experience in this area. She got her doctorate in developmental and child psychology at the University of Kansas. She is focusing specifically on school-based interventions, teacher training, and community-based services for children and youth with high needs. She's a senior scientist at the Frank Porter Graham Child Development Institute at the University of North Carolina at Chapel Hill. She's also a co-director, along with Dean Fixon, of a federally funded OSEP-TA Center for State Implementation and Scaling of Evidence-Based Practices in Education. She has completed recently an extensive review of the implementation strategies and proposed frameworks in providing guidance to the adoption and use of evidence-based programs and practices in education and public welfare. Her keynote address this morning is going to highlight on how implementation science and best practices can guide efforts to scale up the use of evidence-based programs and practices. Join me in welcoming Karen Blase.
Well, good morning. Good morning. A pleasure to be here with you. And it's exciting to sort of be able to preach to the choir. As Dell said, I've been doing this for 30 years, but I still think I look not too bad. And having started at age 12 helps, I know, as a child prodigy. So my title of my talk this morning is Implementing and Sustaining Evidence-Based Programs. Have we got a sporting chance? You know, with the NCAA women's finals leaving here, NCAA men's finals, Jim Alexander, if you're out there somewhere, you can quit rubbing it in about Duke. But I also was reflecting on the Winter Olympics that were in Vancouver. I'm a dual citizen, a citizen of both Canada and the United States. And so I had lots to cheer about during the Olympics in Vancouver. I was always cheering for somebody, and we won all the time. So I think there is something we can learn. I have a backstory for you about the Olympics that you don't know about, but I think is very relevant to our work in implementation. I have a little story that I've been given permission to tell about a country that sadly they did not make it into. No athletes qualified for the Winter Olympics in Vancouver. And so I thought I'd tell you just a little bit about that country and see what instructive lessons we might learn about implementation based on their experience. And the country is called Status Quo. And they were very surprised and dismayed that their teams did not make it to the games because they had, as a country, Status Quo, had legislated, they'd mandated, and they had diligently prepared their athletes. Why? You know, when the rulers of Status Quo heard about the upcoming Olympics in Vancouver, their rulers and lawmakers, they wanted the Status Quo-didians to win big. They wanted them to get great outcomes. They were proud of their country, and besides, all the rulers were up for re-election, and they needed to show that they could achieve great things in short order. So they passed decrees that proclaimed the importance of the Winter Games to status quo. And they passed laws and regulations requiring teams to win gold medals and to use the latest in equipment and technology. through these laws and declarations, they invested big time in paper implementation. Of course, to compete in the Olympics, you needed athletes and teams. So the future Olympians from status quo had to be selected to represent their country. But they couldn't pay them much, and they were really egalitarian, and they wanted to be fair to everybody. So they said anybody could be on the team. So, they selected their athletes without regard to basic skills or any screening for commitment to the Olympic ideals and values. And I'll be darned, a lot of people declared themselves athletes, and they were warmly welcomed to training camp. Now, then training started in earnest. All the athletes sat in a room, and they watched videos of the Summer Olympics. Now, they were not sure why they were doing that, since they were going to the Winter Games, but they felt inspired by their viewing and motivated to do their best. And then they read manuals and papers about snowboarding, skiing, and skating. But there were hands-on activities as well, because they knew about adult learning principles. So, for example, because everyone knew that being a good team player was important, they divided the would-be athletes into groups, and they gave each group spaghetti, gumdrops, and marshmallows, and had a contest to see which team could build the highest tower. And after that hands-on activity, they were declared to have insight into how to be a team member and ready to win big for the status quo. But before they could go to the Olympic trials, there was more important training. They had to listen to lectures and pass tests covering the history of the Olympics, safety on the slopes, privacy in the locker rooms, and the policies and procedures related to getting Olympic badges, obeying curfews, and how to say hello in 15 different languages. And finally, they got their equipment and read their manuals one more time. They engaged in a lot of process implementation. After all, they had been through a set of very creative training processes. Then they went to the Olympic trials. It did not go so well. It seems other countries had been investing for a long time in getting ready for the games at some expense. And in those countries, not everyone got to be an Olympic athlete. They had selection criteria, even to get to the trials, and a different kind of training that involved practicing the sport and conditioning. And they had people called coaches who were experts in their sports and experts in coaching others. And what else they had? They had a lot of data. They had data about how they were performing. They had data to tell them how they were performing compared to the best. They studied new ways to train and play. They went through rigorous physical conditioning. Then they practiced, watched videotapes of their efforts, reviewed other data, tried again. And unlike the status quotidians, they got better and better over time. It seems these countries had engaged and invested in implementation for impact. So, sadly, the status quotidian athletes returned home disappointed and disgraced. The legislators blamed the athletes and said sports just didn't work in status quo. The citizens blamed the legislators, and sadly, the athletes quit sports in frustration and went to work at Starbucks. So, what does the plight of status quo have to do with the use of evidence-based programs and practices? Well, like the status quotidians, as a nation, we need to learn to invest in implementation for impact. So let's take a look at what we're learning about implementation for impact so that we can support and sustain the outcomes that we're hoping for. Make a little adjustment here. So we know there are challenges. Everybody talks about the science to service gap. The best of what we know about science is not being used for most of human services. And there's also an implementation gap. there are not as clear pathways as we would like to implementation. What is adopted often is not used with fidelity and good effect, blueprints programs, of course, being the exception. What is implemented can disappear over time and with staff turnover, and that can be true for any program. At the National Implementation Research Network, we're privileged to look across domains and learn from education, medicine, health, juvenile justice, prevention, and to bring together diverse groups of evidence-based program providers, people who are implementing evidence-based programs, and learn from them about what is involved in implementation. So what have we learned? Well, there are some shared challenges, and this is good news. When we reviewed the literature and spent hours and hours reading about 800 articles that had data about implementation, any data about implementation, it was pretty scarce when we were doing the review. So we looked at the commonalities among weed control projects, hotel management, the Toyota Corporation, engineering, medicine, and it was heartening in many ways because the implementation challenges were common and many of the solutions were common across these domains. So that's great news. It doesn't mean that each of us on our own has to learn everything we know, everything about our work from a single domain. We can actually look across. So many of you are what I would call gold miners. You go deeply into an area and learn very well the content of that area. Those of us at NERN are gold prospectors. We get to survey the landscape and learn enough to look at what these frameworks are and share what we're learning and then put them into use ourselves. So, some things that we learn from the literature and our work is that implementation has not been achieved by doing more and better research on interventions. The usability of a program or practice has nothing to do with the weight of evidence regarding the program. Evidence on effectiveness should help our communities select what to implement for whom, but evidence about the outcomes will not help us implement the program. We will not intervention research our way to implementation. What else did we learn? Well, we learned a lot about what didn't work as we surveyed the literature, talked to people, and listened. These methods, when used alone, do not result in implementation as intended. There's a huge literature on diffusion and dissemination. People cite Ev Rogers' work frequently. Ev Rogers has 2 paragraphs on implementation. Ev's work is about the decision to adopt. What do people do? How do they decide to make that decision to adopt something new? Very little about actually what it takes to implement. Diffusion of information. Huge in medicine guidelines, sending out tremendous guidelines to physicians. Do this, do that, do it this. Very poor results. We looked at some pain management literature. We're like, I don't know, 20,000 studies on effective pain management. And they went to see what people were doing around pain management. Like 12% of the people they surveyed were actually using the best practices in pain management. Training. A colleague of mine did not want to hear this. She just actually plugged her ears. Training alone. But we spend all this money in training. I know. It won't get you there by itself. Passing laws, mandating, thou shalt. When you don't understand the challenges of implementation, mandates alone will not get you there. This is the Nike model of just do it. Providing funding and incentives. You can incentivize things, but that alone won't get you there. And organizational change and reorganization. We can reorganize the chairs on the Titanic as much as we want to reorganize those chairs. It will not keep it from going down. Now, are these useless? No. these are important. They're necessary. They're helpful. They just are not sufficient. Of course people need training. They can't be excited and energized and willing to try something new if they don't know what the it is. My gosh. Well, you'll hear a little bit later. Funding streams, so important to get the work done. Policies that enable us to do this work, critical. These things alone, which is largely where we've spent our time in human services, in attempts to get whole system reform and practice reform, just don't get us there. So, it's a problem. Children, families, communities cannot benefit from violence prevention or intervention strategies that they don't experience. So we have to look at two sides of the equation. We have the what. We need great science about the interventions. If we're going to put all this effort into a what, we want something that works for our families and our communities. We need interventions and prevention strategies that are effective. And we need implementation strategies, the how, that are effective. We have to land in that upper quadrant to get actual benefits. We've got other stuff all over the place. We can have an effective intervention implemented poorly with low fidelity. We're not going to get good outcomes, even though the intervention could be effective. And we can have very effective implementation strategies for ineffective interventions. The DARE program is an example. Now, to their credit, they're going back doing more research. They're retooling that. Great dissemination strategy. And sadly, much of human service then ends up in that other quadrant. I was doing this presentation somewhere, and I had this just up on a flip chart, and somebody went up, just a big sad face in that corner. She says, I'm living there. I'm living there. And we don't want to live there, but we keep doing quick, flashy things. Scared straight, right? We all know how effective that was. The data on that one showed that kids who actually experienced scared straight ended up in more trouble than kids who didn't. Now I saw on television, we have a mobile scared straight. We now have a bus equipped like a prison cell that they're dragging kids through to. We have mobile scared straight. For God's sake. So, you know, the world will continue, and I know I'm preaching to the choir, and it's comforting to me in my old age. So, we need to land in that corner. What else did we learn? Well, near as we can tell, and I always invite every audience I speak to, send me your data showing me that low fidelity yields equal or higher outcomes than programs run with good fidelity. If you have those studies, Sonia said she might have a piece of one for me that showed that, but I've got another 800 that show that poor fidelity across a wide variety of domains leads to worse outcomes. So fidelity matters. What else do we know? I am not a shill for the purveying programs here at Blueprints. This is just what the literature is telling us. To implement evidence-based programs on any useful scale requires a purveyor. Okay, those are the groups here that are interested in taking science to service, that work with communities, that work with agencies to actively promote and help people implement. And purveyors accumulate data and experiential knowledge, and they get more and more effective over time. So as an implementing agency, it's important to interview your purveyor and find out what services they're going to provide to you, how long they've been at it, what they're doing. How accountable do they feel? I was on a panel yesterday with Jerry Bowen from Multidimensional Treatment Foster Care, and somebody in the audience asked, well, gee, what about, what if we don't get the sustainable funding, et cetera? And I still get goosebumps. Jerry says, well, we're accountable for that. That means we didn't do our job. We didn't help you figure that out ahead of time. Now, knowing we can't predict everything, things like recessions happen, and I don't think Jerry thinks he can stop that. But it is that different purveyors view their work differently in terms of how accountable they feel for helping you achieve your results. And this is a new profession. This is a new way of work, and these are different people than the researchers. They're joined at the hip to the researchers and guided by them, and there's lots of good back and forth, but they're not the researchers. It's a different skill set. Scott Hendler will tell you he'd be terrible at purveying work. That's not what he does. He needs Marshall Swenson and that whole gang and Joe Boggs, et cetera, to help with all that. So you need a purveyor. Some purveyors, this is just out of computer modeling in terms of file transfers that go on with a purveyor in the middle. You have an evidence-based program. It needs to get somewhere. It needs to get to practitioners and this whole big culture that's going on. Many purveyors, when they began their work, began at the individual. They were going to do it one practitioner at a time, one teacher at a time. They very quickly learned, no, they needed to back it up if they were going to actually have an impact and scale up. Also, this is actually a different slide. Purveyors are now understanding that if they really want to take things to scale, they also have to begin to think about how they're going to help states and agencies install infrastructure of their own. How are they going to help them, and what are they going to allow them to own and monitor the quality of? So you begin monitoring the quality of the implementation strategies, the training, the coaching, the data systems, and creating more units that can scale up. The other thing active purveyors have learned is that this is why the work is so hard and why purveyors go gray early on, is that you are pushing all the pieces of the system at the same time. So you quickly learn you have to create this hospitable environment for the work that you're doing, and you need to begin to intervene at every level. And yesterday I said, how many people were aware of dialectical behavioral therapy at the Marie Institute out of University of Washington. Their first stop when somebody says they want to replicate that therapy for people with antisocial behavioral disorders, their first stop is Blue Cross Blue Shield. They go in, they show them their data, they say hospitals and therapists here are interested, we're thinking of coming, we want you to establish a billing code. Did they start there? No. They spent a lot of time watching their program get washed out and doing a lot of work that was not leading to sustainable results. So we're learning that it's the push on the system. It is a way to create systems reform, systems change. The other thing that's emerging, somebody came up to me last night and said, now I know what I am. I'm an intermediary purveyor organization. I have a name now, and I'm not sure I know what I'm doing, but at least I know who I am. So what we're finding is that, again, to go to scale, it's very difficult for a purveyor to really have the local, I'm Italian, and it's the hand thing and the microphone's in the way, the local context, the funding and political context at the local level, and the fact that many states want to scale up multiple evidence-based programs. There's actually a trial going on about ways to do this with multidimensional treatment foster care. So to what degree can the intermediary at the state level pair up with purveyors to help move evidence-based programs into a state or a region? And it's worth just a moment on how we're seeing intermediaries, and this is emergent. It isn't like people went out and said, let's all get together and develop some intermediaries. We're just seeing this bubble up from the ground. So we define intermediary organizations as state-based or statewide infrastructures, kind of a premier model. I went to Brian Baumgartner's presentation yesterday on Pennsylvania. Pennsylvania is kind of a prime state-level example of this. There are other kinds of purveyors that are kind of age-based, like Invest in Kids in Colorado and the Center for Effective Interventions in Colorado, Connecticut, etc. There are many of these around the country. But they have these roles of broadly educating the public about getting them ready for this idea of evidence-based practices, how to help communities assess need. So it's not like, evidence-based programs are all the rage, I got to get me one. No, actually you need to find out what your needs in your community are and then go see what it is that might be helpful to you. Helping people assess the science, bringing in the purveyors to talk to groups about the science that's available to help ensuring implementation fidelity, building capacity in the community, helping with alignment. So these seem to be very important functional groups that are emerging in the states that are working with purveyors. So what else works? And I'm going to put these just into 4 big buckets for you that you can think about with the evidence-based program you're implementing or purveyors that you work with. And this is our toolbox that we use when we go out to work with states and communities. This is the science and practice that we teach them. And we think these are all important to know and understand. And I'm betting that you will see yourselves in these. So let's start and just spend a little bit of time on the implementation drivers. And what do we mean by implementation drivers? These are your leverage points for changing the behavior of well-meaning human service professionals. Much more challenging than changing the behavior of children, adolescents, and families. So, there are a series of drivers that are necessary to help people become confident and competent in their work. And the cute little guy in the middle with his little implementation lens is a prompt for me to spend a few minutes talking to you about how these drivers function and look through an implementation lens. Because after all, most agencies are already selecting staff somehow, right? They have hiring processes, etc. They're doing some training. I'm talking now not necessarily the training for the evidence-based practice. I don't think much coaching goes on in organizations, mostly supervision and did you get your billable units done and those kinds of important things. And then we don't typically have fidelity assessments as kind of a staff performance goal. But these are the variables that you push on in order to improve staff confidence and competence. So they have a set of best practices that we review with folks around how to increase their robustness for implementation. So let me give you a couple of quick examples. Selection. One of the things that we advocate is that part of your selection criteria should be about how coachable is the person. You need to have, because what's going to happen in the implementation of an evidence-based program? You're going to get lots of feedback. They're going to have to use data. So we ask people at the end to construct a behavioral vignette at the end of their interview. Ask people to try out a little part of the job that they're going to be doing. We really don't care how well they do that little piece as long as it's not immoral or unethical. And then the real interview part starts that the interviewee doesn't really know, which is that we're going to give you feedback and ask you to try a part of this again. How receptive is that person to receiving the feedback in the interview? They should be darn receptive in an interview, right? They should be going, oh, yes, I can do that for sure. Actually, I've had people go, well, really, I disagree. That wasn't the way I was trained, and I really don't. I'm thinking like, what? Come on. So, and then the second part is, given good behavioral feedback, you have to have a well-qualified interviewer, giving good behavioral feedback, can they actually change their behavior? Right there in the interview. Some people are better at that than others. I've sometimes done a second role play. I've said, no, really, feel free to use my words. You can just say what I say. This time when you start the interaction, start with an empathy statement. Say, Del, I know it's really hard and frustrating to run a big conference. So kind of just try those words. No can do. So you learn that, okay, I may still have to hire this person because I got workforce issues, but I know I'm going to have to compensate. I'm going to have to do a lot of hard. This person's going to be hard to have in training. They're going to be hard to coach and supervise. Well, you might hire them. I wouldn't. I'd go do the job myself for a while first before I hire them because I've done that too many times. I don't know. Like, what's the definition of insanity? You keep doing the same thing, hoping you're going to get a different result. Well, I did that a few times, and it didn't work. So selection with an eye towards implementation, a piece of that is about evaluating the coachability of that person and feeding forward data from the interview and information from the interview to the trainer. If you're a small agency and you're the responsible for selection training and coaching, man, you got great integration. You don't have to worry about that. The bigger you get, the more formal your feed-forward systems have to become in order to be effective. Training. Training is not training for us unless you have pre-post tests. How do I know you didn't just sit there? This is not training. This is a nice keynote speech. I get to come to San Antonio and be with all of you. It's great fun for me. But training means we've had behavior rehearsals. We've had some skill-based work together. We've practiced little pieces of the job. We've gotten qualified feedback. We're not going to do that training, and I apologize if I'm inadvertently stepping on any purveyor's toes, but it is what it is. We're not going to do that kind of training where you all are trainees in the program, and I'm going to give you some material, and you're going to practice together, and then you're going to give each other feedback? Oh, no. You don't know what you're doing. That's not a good recipe. And if you do know what you're doing, we didn't need to do that behavior rehearsal. So, coaching has to include observation, has to include some data, has to include multiple sources of data. Only asking you to reflect on what you did outside the situation and describe that to me will not be effective. We're not that good at observing ourselves. I think as people gain experience, they get much better at it. And if they have some data, that can come along over time. But don't, sort of like, I'm new to the job, don't ask me, so, what do you think you need to do, Karen, to build a nuclear reactor? I don't know. I know there's some rods. I need a lot of water. I don't know. It's like there's some safeties, like really important. But don't try to, quiz me about, what do you think? What do you think was going on there? It just frustrates the heck out of new people. Reflective coaching comes along later. So, just a little, this kind of high-level stuff that we want to fly through. So the other part of the implementation drivers is preceded by this little sobering comment that all organizations and systems are designed intentionally or unwittingly to achieve precisely the results that they're getting. So however our service systems are set up, they're designed to get the results that we're getting. So if we want new results, it makes sense to us that we're going to actually have to change the status quo. Those darn status quotidians keep popping up. You're going to have to change the status quo. How do we do that? I'm going to talk in more detail later, but we ask for good decision support data systems. These are data systems that have accessible, reliable, valid, practical data at actionable levels. Don't send me the state data on X that cannot be disaggregated by practitioner. You've got to get that data down to the practitioner level at best, down to a unit or classroom level at worst, so you know where to intervene and how to get your decisions based on data to know whether you're successful at improving your organization. Facilitative administration, our little mantra for that is there are no administrative decisions. They're all treatment and intervention decisions. Quick story, although I wish it weren't on tape. Will I get sued for this? Let me think. I think not. I think I actually have permission for this one. But a state and agency that will remain nameless that was implementing an evidence-based program for depression in older adults. And we know how stigmatizing mental health problems are, and this is an evidence-based program. They were gearing it up. Quick referral from the physician. If you checked out on one of these variables, boom, you went over to a trained social worker who was there to provide support. And so how does this go? New program starting up. Person gets referred over, and my name badge says, "Hello, I'm Karen, your depression specialist." What? Okay, so it was the HR department's responsibility to make your name badge, which they made off of however this was listed in the grant, and the grant said that these people who are being hired were going to be depression specialists. And so the HR department had made a treatment decision to further stigmatize mental health problems in older adults. How interesting is that? So there are no administrative decisions. They all need to be filtered through the lens of how is this helping or hindering the frontline practice to work effectively with the people that we're supposed to be helping. Systems intervention, all systems are designed to produce the outcomes they're producing. I'm going to talk to you a little bit later about alignment and systems interventions and how we do some of that. So the point about the organization drivers is, I'm going to have to figure out where I am here. Hang on. Twitchy finger. Is that because the existing system and status quo is there, often what we find is that effective innovations get changed to fit the system, which accounts for some of the program drift and fidelity drift. Well, we can't do that because of this regulation, that law, the way we're funding. I can't afford to lose that many billable units. We're only going to train them for 40 minutes instead of 2 days. That's all I can afford in terms of training. Or, I don't know if you've ever been in these groups, I've been in the shadow system where don't tell anybody, but I kind of have figured out how to get around this one and do that, and I think we'll get away with it because, and I'm keeping that information from those people. So we create kind of this ghost system in which the extraordinary manage to survive as an innovation. What we need to go for in terms of organization and systems change is really to create a host system so that the laws, regulation, funding are changed to actually create a hospitable environment for the organization. I'm going to talk a little bit about how we help people do that. Finally, leadership. This is not in our monograph. It's something new. I don't feel like it's as grounded in research as I would like it to be. It's an area that we know is critical. So we're very taken with the work of Ron Heifetz, Heifetz, I think, at Harvard School of Business, and his work on technical and adaptive leadership. That's all I have time to say about that. There's time afterwards. You can catch me and we'll talk about the difference between technical and adaptive leadership and when you use what kinds of leadership strategies. But again, haven't done the data review on this, so it's a data crowd, not going there. Integrated and compensatory. This is good news. Well, the integrated piece means is you're highly focused on those outcomes. You're not selected on one set of criteria, trained to do something else. You get to work and your supervisor says, I know whatever they told you in training, but this is how we do things here. Evaluated on general things like getting to work on time, getting your billable units. No, this is all focused on high fidelity, which means you're going to get great outcomes. So it has to be integrated. And it's compensatory. You're not walking in as the perfect person to run this, to do this program. We'll compensate for what's missing in selection through training. Everybody walks out of training with something a little different. We'll compensate for what you didn't get in training through coaching, etc. So the compensatory integrated thing is a good deal. So a little bit about stages of implementation. Our funders and legislators really need to understand this, and we're seeing a little bit of movement. We're seeing a little bit of movement here around stages of implementation. So really, when we talk about stages, we're just going to talk about the first four are really stages, and innovation and sustainability are other things that are out there that are important. So, in general, I'm not advocating for this. In general, the data indicate it takes 2 to 4 years to move from exploration through to full implementation. And this works so well for our funders and legislators, doesn't it? When do they want to see those full, great outcomes? We'll give them 6 months, maybe a year. So often I worry that babies are getting thrown out with the bathwater. And really, oftentimes what we're evaluating are programs that are not yet fully implemented. Everybody is new at what they're doing. The wobble is huge, right? So, exploration, we're seeing a little good movement on the federal end and a couple of recent grants. Administration for Children and Families and a recent evidence-based home visiting set of grants actually funded a year for exploration, preparation, getting up to speed. We think that's fabulous. SAMHSA used to do that with some of its work till OMB got a hold of it and said, we're not paying people to talk to each other. Where's your outcomes? We're not paying people to talk to each other. Turns out it's really important for people to talk to each other. So, we tell people about exploration. Don't worry if you didn't go through it. You will get dragged back to it. You can't go there without bringing your community, your data, your partners, without the discussion, without people raising concerns. You have to bring them with you. Installation is a stage that's very overlooked. This is the time when you're spending money and nothing new is really happening. You're training, you're selecting, you're getting your cell phones, you're finding your office space, and you're getting your referral pathways. Okay, this is where the status quo starts to push back here and in initial implementation. Right? All these referrals. Oh, we needed this program. We had to have this program. Where the hell are the referrals? Okay, you're pushing on the system, and with finite resources, sadly, unless you're getting a new funding stream, which is not less and less likely, somebody's losing some money if you're getting some money. So the system starts to push back at that point. Initial implementation, our motto for initial implementation, because people remember these short little things, is anything worth doing is worth doing poorly. Because how do we start? Do you remember the first time you drove a standard shift car? That went well. Mm-hmm. Yeah, the first pancake on the griddle, mine usually goes in the garbage. I don't know, maybe you were different than I was, but my first kiss was a huge disappointment. Got better over time, but turns out even there we needed to practice. So anything, and everybody's new, right? You got new. You haven't been able to grow up your coaches and your supervisors through your system. I mean, they're learning the innovation while they're trying to install it. I think Joe Boggs calls it like the front end of the airplane, where we're still desperately tacking on the wings as we're moving forward. So it's not going to go well. You need high-level protection. You need your champions. People need to be alert. People need to know that this is how it's going to go. Your outcomes are not going to look great, probably on those first families, those first classrooms, those first months of service. And you work towards full implementation, where it really is, this is just how we do business. What do you mean? This is no longer an innovation. This is how we do our work. And you don't have an entirely new group of practitioners, therapists, teachers learning something. You have a person at a time that gets incorporated into the culture along with the rest of it. And we don't have time to say much about innovation, except innovation is not about doing things differently. It's about doing things better. So if you're going to do an innovation, you've got to collect data. You've got to find a spot. You've got to do the program as intended. Look at your data. Say, I think we can do better. Specify what you're going to do differently in order to do better. Review your outcomes. And then if you've done better, you've got to think about your drivers. Okay. When we found out that we needed to teach our teaching parents in our group homes more about dealing with kids' emotional development, giving them words for emotional language, we had to go back and think, it might be helpful during selection if we kind of see what kind of a emotional vocabulary people have. If you know sad, angry, and mad, and those are the only 3 feelings words you have, and I'm asking you to help children specify a range of feelings, it's going to be hard. And how would we train people to do this? And now how are we going to evaluate them to do this? So an innovation has got to be better, and then you've got to install it. It will give you pause about messing with what you've got that's working. Sustainability isn't a stage. It starts at the beginning. You start and you think about how you're going to fund the face-to-face service and how are you going to fund the infrastructure. And I want to take you back just really quickly to this. This is the infrastructure. And this is what we have to teach our legislators and funders to provide resources for. So our analogy, all analogies break down somewhere, but this one is about road building. And so we say, legislator, regulator, if you funded road building the way you're asking us to fund human services, you would say, you know what? I'm only paying for tar on the road. That's it. I don't know what these gravel trucks and cones and those things on tripods are for, and these soil samples. That's like administrative overhead. I'm not paying for that. I want tar on the road. I got 10 miles of road, and I'm coming out in 2 weeks. I want to see that road working. That's how we fund human services. I'm paying for the face-to-face time. I get that. I get I need teachers in the classroom. I get we need therapists doing that face-to-face work. This other stuff, I'm not paying for it. Now, why is that? I think one reason is, or a couple reasons. One reason, the infrastructure needed to build a road is visible, right? Every day you are cheering on the infrastructure. Go gravel trucks, go tar trucks, go line painters. Oh, there's that darn arrow pointing me over into the other lane. The infrastructure is visible. It's clear to us. If we don't have those things, we don't get a road. So we need to make this infrastructure visible to our funders. We need to have, through research, through implementation research, have them understand the importance of these variables. If they want this, they have to fund that. And I don't blame them, because a lot of the previous that was crap. Right? It was and I'm guilty. I've done the spaghettis, marshmallows, gumdrops thing, but I did it to have fun. I didn't really think we were going to actually do anything differently when we left there. But really, I don't know about taxpayer dollars going for that. I spent a lot of time in hotels. I walk up and down and see the kinds of spray and pray training that's going on in there for business, for everybody else. Nothing's going to generalize out of that training, so I get it. But we have a big education agenda with our legislators and funders about the importance of this infrastructure. That's my pitch. Implementation stages, we've done that. Implementation teams. Why teams? I think we heard some great examples yesterday in some of the presentations about the dangers of relying on an individual or an individual champion. If that person becomes ill, dies, loses interest, your expertise walks out the door, or your champion walks out the door. So we help people build implementation teams. On that team is someone who does know the innovation well. So often we ask experienced people who have run the innovation to be on that team, or the purveyor is a regular or distance partner on that team. We help teach teams implementation science and how to use it. And that team needs to be used to using improvement cycles as an overall general strategy. And I'll talk to you a little bit about what that is. The other thing, and this kind of leads us into the fact that if you're doing systems change, if you want to do big, I promised a little bit about this would be about scaling up, is that you really need kind of implementation teams at multiple levels that are interlocking and integrated. So if you have agency teams, those agency teams need to have a way to give feedback to a community level partnership, who need to have a way to give feedback to the state. And all of those teams should be focusing on fidelity and outcomes. How do we align policy and funding practices to support this? What kind of problem solving and sustainability work do we do? How are we building capacity? So the communication linkages are really important in terms of building alignment. I think it's why many purveyors are going in more at the systems level, because they know they're not going to do it one teacher at a time, one class at a time, one school at a time, one outpatient therapy, one mental health agency at a time, etc. So we're starting to learn the importance of going in at a systems level. The other thing that implementation teams do as they begin with their work in the exploration stage is they are creating readiness. We often talk about readiness, and and there are a number of scales that are helpful to measure how ready you are, but we aren't waiting for readiness to happen. We have to be out there actually creating readiness. People can't get ready for something that they don't know anything about. You have to bring them with you. Many times a small group of people have gathered, a small leadership team at an agency, a small collaborative group in a community, and they have gotten themselves ready. They're gung-ho. And then they go out and proclaim it. And people go, I don't think so. And then we call them resistant. No, we just haven't taken them on the ride with it. How many of you, if I said trans-theoretical model of change, would raise your hand and know what I'm talking about? All right, Prochaska di Clemente, stages of change. You need to know that. You need to know that people and organizations are in pre-contemplation, There's no problem in our agency. There's no problem in our school. We don't have bullying problems here. Really, our kids in foster care are fine. Really, our young children are not suffering, Oh, first-time mothers, they're fine. There's nothing to be at pre-contemplation. There's not even a problem. Smoking, I don't have a smoking problem. Smoking is not a problem. Okay? Then we need, so a different kind of intervention needs to go on there to get people ready to consider the fact that there might be something that's a problem, to move people to contemplation. Well, let me think about that. Maybe I'll think about my smoking problem. Maybe I'll think about poor first-time mothers and what they're going through and the importance of early development. I'm going to begin to think about that. And then I'm going to get myself ready for action to say, well, what would that mean for me? Because it is all about me. What does that mean for me? What does that mean for my agency? How would this impact me? What's going to happen? So I'm not going to work with people in pre-contemplation and contemplation by inviting them to action. Oh, come be on this committee. We need to put this together. We need to get a to-do list organized. We need to go, go, go. No. People will back away from that because you're not matching them where they are. So when the leadership management team of an agency says, we're going to do evidence-based programs, we go out and proclaim it to the therapists, of course they cross their arms and go, I don't think so. A friend of mine, Ray Kirk, says, Karen, you've skipped a stage. There's actually something before pre-contemplation. I said, really? What's that? That wasn't in the literature? He says, it's militant pre-contemplation. As in, hell no, I will not go. So, it takes time, and it takes active readiness work that the implementation teams will need to be doing early on to get people ready and on board to decide what to do. Finally, improvement cycles. And we work with 4 sets of improvement cycles when we work with people. I'm only going to touch on 2 of those here today. Transformation zones, policy to practice to policy feedback cycles, rapid cycle teams for problem solving and practice improvement and usability testing. So what do these all have in common? Don't worry about these. We'll go over them later. It's not important. What's important is the next slide. What do they all have in common? They're all based on PDSA cycles. Plan, do, study, act. And this is just common sense, right? You make a plan, you execute the plan as intended, you see what happens with data or anecdotally, you go back to the plan, you replan, you do again. No. In our country, I know there are lots of people here from foreign countries, and maybe your cultures are different. The American culture is plan, do, plan, do, plan, do, plan, do. And we get do-do. So, this is not an inherent way of doing business. And so you have to be conscious about the steps of a plan, do, study cycle to do any kind of improvement work. There was a meta-analysis of classroom feedback systems. And feedback is so critical. All the way back now to the selection driver. You've got to build that culture. You've got to build that learning culture that lives and breathes plan, do, study, act cycles. So, just a little bit, because again, I promised some words about scale up, about transformation zones. What do we mean by a transformation zone? Well, we need demonstrations. Somebody's got to be the first multidimensional treatment foster care. Somebody's got to be in the state. Somebody's got to be the first NFP team of nurses, etc. So demonstrations are helpful. Pilots are helpful. It's possible in my state because we know, of course, there are no common variables among human beings across any states. Every state is completely unique, and their children are totally unique from any other. So we got to, prove it in our state. So pilots are useful. It's possible. You can show people, oh, really, we can do this in North Dakota. We can do this in Minnesota. And, even in Delaware, we can do this. But these pilots, and Kelly Teeter yesterday was talking about NFP, and the wobbliness around having one team in a state. They don't usually lead to sustainable service and systems change. They're kind of random acts of innovation that are going on in the state, and they're often very person and passion dependent. And when you're small, you can ghost your way to success. Okay, you can work a system and work around the system these pilots are often executed by the extraordinary, the early adopters, the people who take risks, who are always it's all of you. You know, people say, yeah, we can do that. We can do that. We got a whole second wave, third wave of people who are not you. How are we going to bring them into the fold? Not through pilots. And there's no replicable infrastructure. Those drivers are not thought through in terms of where's the locus of control for those drivers, who's responsible for the quality, how do we keep them integrated, who's responsible, how do we fund them. There's no infrastructure. So, you know, when the trained therapist, teacher, nurse walks out the door, the expertise walks out the door, unless there's a way to replace them. So pilots are important to demonstrate it. But then what? Then sometimes we want to go, let's go statewide. Go statewide. We've got to go statewide. Our Medicaid funding structures, unless you have a waiver, are not very helpful in this regard because they kind of require that you go statewide, which typically is a recipe for disaster. So we like to get people to work in what we call transformation zones, and that's a service zone that can focus on adopting and installing the innovation, the implementation infrastructure, working on organizational change, working on systems change. So it is this messy place in the middle. We ask people, don't even use the word pilot. What happens when you use the pilot? I can outlast that one. I've seen pilots come and go. No, this is a transformation zone. This is the way we're going to do business in the future. Get on the bus. Okay, who wants to be at the front? Who wants to go with us on the ride? So this is the way in which you do systems change. So it's really a vertical slice of the service system. If you're Marlene Snyder, Marlene is from the classroom to the Capitol. If you're MST, it's from the clinician to the Capitol. It's the entire vertical slice, or FFT or BSFT, I don't want to forget anybody. So the slice that you're working in is small enough to be manageable. And you don't go through, okay, well, let's train everybody in the state. Well, 2 years later, we've trained everybody in the state, and 40% of the people we've trained have quit. Now what? We wasted a lot of time and money training everybody in the state. No, we're going to do a slice that's small enough to manage, but big enough to include all aspects of the system. Urban, frontier, diverse communities, providers, partners. May not be geographically even proximate to each other. It might be these 5 counties will be where we're going to work. And the slice is large enough to disturb the system, because you will disturb the system, so that the ghost system cannot work, so that the political and funding issues actually bubble up and get recognized and identified, and some problem solving can go on in relation to them. So they provide us with the opportunity to manage risks, meaning let's not make a mess of the whole state. Let's just make a mess in 5 counties and clean it up really quickly. Let's limit the damage so we can quickly detect it, repair it, do a PDSA cycle, move on. We can document what works, and we can consider the implications for scaling up. Okay, these are the problems in these 8 counties, these 5 cities, these 12 schools, these 4 school districts. What are the implications for scale up? Should we go statewide? Let's think about that. Systems alignment. I keep thinking, given that Dell persisted in saying how old I was, that I should be trying to do something simpler in my old age. So, policy to practice feedback cycles. We're used to this piece, where policymakers make a plan for us, and often an informed plan. Lots of good work goes on about bringing people in to discuss what the plan should be, the policy, the funding streams, how we're going to do this. And so we want policies that enable practice, right? We've got a plan, we're going to push it out, people at the practice level are going to do it. Policy drives the structure, policy drives the procedures, policy drives the practice. Well, yes, but we're missing something, right? We got the plan, do, plan, do. We got plan, do, plan, do. What happened to study, act? We need practice-informed policy. So we need information to come from the practice level, unfiltered, back to our policymakers to say, this is how it's working. A transparent, formal system that allows this kind of feedback loop. So that the policy, structure, procedure, practice, are there to support the new way of work. People get really excited about this, and people say, oh, that's what's missing. We don't have the PIP side of this, the practice-informed policy. We don't have those feedback loops. Okay, so everybody gets really excited because they see themselves finally on the PIP side. By God, I've been wanting to give Medicaid a piece of my mind about their funding structures. Now is my opportunity. By golly, those darn purveyors, they don't understand how hard it is. I can hardly wait to, talk to them about what they're asking me to do. At some point, though, people realize, I will actually be on the receiving end of that PIP cycle. If I'm an agency administrator, I'm going to have my practitioners and clinicians giving me feedback. If I am a school principal, I'm going to have my teachers giving me feedback. If I'm a district administrator in a school system, I'm going to have the principals at my door giving me feedback. All of a sudden, it feels a little less comfortable, but critical. Because this is how, over time, and never perfectly, we can get systems to better align to the work that we're trying to do. Purely an accident that the feds kind of come in last. And it'll never line up. There's always wobble. But a great thing that evidence-based programs can do, and that this kind of work can do, is we can reduce the wobble. So we don't have such wide fluctuations in our program quality over time, across therapists, across agency. We can narrow that variation around the ideal. So we need all four of these. They need to work together. I'd love to give you like a linear thing with boxes and mediating and moderating variables and a big... I just can't do it. These things are always in play all the time. A little bit about scalability. What do we mean when we say going to scale? Well, there's another thing that has no definition. Arnie Duncan, the new education head, in his kind of acceptance speech had kind of these exemplars on the podium with him, and I don't even remember the name of one of them, but he was talking about how they were scaling up, blah, 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 I forget what it was now, at 82 schools. I don't think 82 schools is scaling up. Okay? So how the next big challenges, while we're still trying to cope with all the current challenges, is how do we make this a routine way of work? If we could get, we think it's ambitious, but if we could get 60% penetration rates, where 60% of those who could benefit are benefiting from an evidence-based program, that would be spectacular. What do we know? Well, we can't scale up until we implement. First we implement well, then we scale up. Don't get ahead of yourself. Remember those PDSA cycles, those transformation zones. You've got to build capacity. You've got to build human capital. You can do it in a more purposeful way with an eye towards what's this going to look like in scale up, but it'll take time. You can start with demonstrations, but you're always thinking out. Thinking up a level, down a level, and out 5 years. That's systems thinking. What am I doing today? What's the impact up a level? What's the impact down a level? What's the impact out 5 years? So scale-up is going to require change at practice, organization, and systems level. It's not going to be like a plug and play on your computer, right? This is going to be big. It's going to be moving from Microsoft DOS to an Apple system while you're downloading the biggest files you've ever done while you're moving. Or for those of you that are more mechanically minded, you're changing the fan. They don't have fan belts anymore, but they used to have fan belts. Changing a fan belt on your car while the motor's running. This is not easy stuff. So, where are we now? As many of us as there are, and much work is going on out there, really, evidence-based programs are still largely boutique operations. We have convincing demonstrations that evidence-based programs can be implemented in the real world. That's wonderful. But how do we begin to solve social problems with them? I think there's wonderful work being done in Pennsylvania, communities that care. It's that kind of public health thinking that we need. But current estimates of some of the best usage data, I think it's probably more like 10 to 15% of those who could benefit from a given intervention are actually getting something that is evidence-based. So there are challenges to scaling up. It's a long and winding road. You have to first have capacity. You have to first have a core of people who can then begin to think in levels. And the infrastructure costs to build this road are also not fully understood or accepted. We're still actually out building the road and trying to figure out what it costs us and how to do it effectively. And it requires aligned changes at many levels. You cannot ghost your way to scalability. You've really got to get some of those key funding and regulatory policy issues resolved. And we aren't always good at recognizing when it's time for a scale-up shift. I have to enunciate that really carefully, a scale-up shift. And what I mean by a scale-up shift is that infrastructure, those drivers, we need to rethink how we're providing that service. Are we still in the Mecca model where to be a practitioner or a teacher or to use this model, you've all got to go to a central location in the country? Everybody's got to fly to, Auburn, Alabama, or fly to, Cheyenne, Wyoming to get where the developers are to get trained as a practitioner. That's okay for seeding and getting started because you want to keep tight control over your independent variables like training until you figure out what it is, what training really is. But it's not scalable unless you're going to, have your own airline. And it's not cost efficient. And so you start thinking about, well, how do we build these scale-up shifts, and when do we build them, and how does that go? And you're going to have to think about it as a state. You have to think about it as a large agency. You have to think about it as a purveyor. How is this infrastructure going to be built? And each link, those of you that want your research careers, there's a couple lifetimes of research. How each link in that chain requires resources, requires rigor, and it requires research. So there's a lot that we need to do this. So what will it take to give us a sporting chance? We need science. We need science related to interventions and programs. We need science related to implementation, to organizational and systems change. That's tough science. That's hard work. We don't have the methodologies all worked out for that. And there's some wonderful people in this room, Lisa Saldana, Sonia Schoenwald, likes of Greg Ahrens, Glisson. People are doing this work and learning how to do it. We need infrastructure funded. People have to be willing to pay for the training, the coaching, the data systems that we need. We need informed communities. We don't want communities that are doing the Chinese menu. We got to get me some of those. I'm taking one from column A, two from column B. No, we don't want that. We want that communities, that care framework of looking at your community data, seeing what's available, making an informed decision. We want skillful purveyors and intermediaries. So my next big project is going to be kind of gathering well-qualified, excellent purveyors and intermediaries, and we're going to do an implementation academy for purveyors and intermediaries. Competent providers, agencies who understand what it's going to take, supportive organizations, all creating hospitable and aligned systems. And we need leadership at all levels. So if any of this implementation business intrigues you and it resonates for you, Sharon said since there wasn't a Blueprints conference next year that I could tell you about our planning for a 2011 global implementation conference to integrate science, practice, and policy of implementation. So we're bringing people together across domains, researchers, agency people, practitioners, diverse cultures across medicine, health, education, violence prevention, to focus on these tough issues of implementation and learn from each other. So it doesn't cost you anything to pre-register. It just helps us get funding for this conference, which is coming along very well. Go to the website, www.nfpa.org. implementationconference.org. There's also a place to sign up. We need lots of worker bees to help pull this off. So feel free to join committees. And I thank you for the opportunity to speak with you today. And we have a few minutes for questions. Are there any questions that people would like to try to shout out or brave the... I know public speaking is like the only thing people fear most is death by fire, so these aren't always the best arenas for people to speak out. I don't see any hands, so that means I've been... Oh, there is a hand, yes. Yes, it'll go to Sharon. They're going to get posted on... Blueprints Conference website. These will be online, and I will make sure that Sharon has a copy of the slides. All right, obviously I was scathingly brilliant because there are no questions, and you now know everything you need to know about implementation. Have a great time at the conference. Thanks for the invitation.
We have a little extra time, which is fine, but we're right on schedule, so please be to your workshops at 10:15. Thank you.
All right. Get my computer off of here. It's my computer. I just was going to walk off and leave it.